Thank you for joining this symposium. My name is Kennichi Kakudo, a pathologist specializing in thyroid disease, and the author of the books shown in this slide. The title of my lecture today is Thyroid Nodules, Are They Malignant or Indolent Tumors? I have nothing to disclose. This illustration is an example of pediatric papillary thyroid cancer found in 16-year-old female patient. A solid mass, 2 by 3 cm, occupied the right lobe of the thyroid. It showed papillary growth and invasion into thyroid parenchyma. No recurrence for 7 years after initial surgery. This Kaplan-Meier survival curve is from Enomoto et al. From Noguchi Hospital, Japan. Only 3 patients out of 142 died of thyroid cancer, and the cause-specific survival at 40 years was 97.5%. More than 70% of patients achieved a complete cure after the initial surgery. Please note, the horizontal axis is not months, but years. There is a 97.5% probability that a 16-year-old child at surgery is still alive at 56 years old, which is better than or equal to those without thyroid cancer. The Japanese female has a 97.082% probability of living. It means a 2.918% risk of death at age 56 years old, according to the average life table of female, while the 16-year-old thyroid cancer patient had only a 2.5% risk of thyroid cancer death at 56 years old after surgery at 16 years old. One of the notable features of thyroid cancer is they are mostly indolent tumors, and this type of cancer rarely causes death. Verachimis et al. From West Germany analyzed more than 1,500 adult patients with well-differentiated thyroid cancer. They showed patients with stage 1 thyroid cancer had a favorable prognosis equal to or better than those normal control subject. It is not a malignant disease, but a neoplasia with indolent behavior. Pathologists, clinicians, and patients have different concepts of cancer. The pathologist knows thyroid cancer are heterogeneous, ranging from borderline precursor lesion or low-risk carcinoma, which is simple excision is curative, similar to benign tumors, to lethal malignancies. However, most clinicians and patients assume if a label of cancer is given, it will inevitably progress and metastasize, leading to death. It is not true for stage 1 papillary thyroid cancer. This illustration is by Welch et al. Published in 2010. Cancer is a heterogeneous disease and can be classified into 4 types: first-growing, slow-growing, very slow-growing, and non-progressive. The first-growing and slow-growing cancer is a malignant disease if left untreated. Early detection and proper treatment save patients with slow-growing type cancer. The other 2 types, which are very slow-growing and non-progressive, do not kill patients if left untreated. The first-growing cancer and the slow-growing cancer are rabbits, true cancer, which kills patient if left untreated. The very slow-growing cancer and non-progressive cancer would be tattoo, the non-lethal tumor, even if left untreated. Most thyroid tumors found by cancer screening in asymptomatic adults and children are very slow-growing tumors. Detection and cancer surgery to those tumors do not benefit and create significant harm to the patient. Let us confirm the definition of cancer. From the National Cancer Institute Dictionary of Cancer term, cancer is a term for diseases in which abnormal cells divide without control and can invade nearby tissue. Papillary thyroid cancers often show invasive growth beyond the thyroid capsule and are invasive into the surrounding anatomical structures, such as muscle, trachea, nerves, and vessels. Papillary thyroid cancers often develop lymph node metastasis at high incidence at the surgery. Most papillary thyroid cancers fulfill one of the two criteria, can invade nearby tissue of the cancer definition. Thus, papillary thyroid cancer is classified as cancer. This illustration from an observational study of small, less than 1.5 cm papillary thyroid cancer by Tattoo et al. From United States. From the study, only those patients in green box, only a small fraction of patients, less than 15%, showed tumor size increased more than 50%. The orange color means tumor diameter increased more than 3 mm, only 3 mm. The majority of them were unchanged or decreased in size, and some disappeared. Papillary thyroid cancer grows very slowly and often become stable. The majority of them were unchanged or decreased in size. That is self-limiting. Some of them become undetectable clinically. That is a spontaneous regression. Therefore, the majority of papillary thyroid cancer does not fulfill the second criteria of cancer, abnormal cell divide without control. Thus, tattoos not a killing cancer. How can we distinguish rabbits from tattoos in thyroid practice? There are 3 different strategies to examine tumor growth rate: preoperatively, immediately after surgery, postoperative follow-up, observation of thyroid nodule without immediate surgery until they develop any adverse events, Ki leveling index using surgical specimen, doubling time of thyroglobulin after total thyroidectomy, if recurrence of metastasis appears. As I'm a pathologist, I'd like to introduce only the second strategy today. We have proposed a prognostic classification of thyroid tumors defined with Ki-67 leveling index in 2015. The invasive tumors were risk stratified into low risk, moderate risk, and high risk carcinoma. This classification identifies high risk thyroid cancer very accurately, with Ki-67 leveling index more than 10%. This is an example of rabbits killing cancer The patient developed metastasis in the brain and the bones. Please note high proliferation index, about 20% of true cancer, demonstrated by K67 immunohistochemistry in the lower right. In my classification, this tumor is classified in high-risk thyroid cancer. These illustrations are from 32-year-old female patient with papillary thyroid cancer. She had bilateral tumors and lymph node metastasis, that's carcinoma. However, proliferation index was very low, less than 2%, and does not fulfill the cancer definition, abnormal cell proliferation without control. This is an example of turtle thyroid tumor, but all pathology textbook classifies it in cancer category. To summarize, most thyroid cancers in children, adolescents, and young adults are papillary carcinomas. Papillary thyroid carcinoma is one of the most curable diseases of all cancers. More than 99% of patients with stage 1 papillary thyroid cancer remain alive at 20 years after surgery. More than 80% of papillary thyroid cancers are self-limiting and does not fulfill the cancer definition. Non-cancer terminology help clinicians understand that limited surgery is sufficient to cure the patient. It also helps to relieve patients from anxiety. Thank you for your attention. Peace of mind for patients.